Sambandh Health Foundation was started in 2011. We basically work in two fields. So we have two divisions like mental health and tobacco control. And I work as a project manager in the tobacco control division. And as I told, our vision, our mission is to reduce the prevalence of tobacco. And we have a team of IITians, IIMs graduates who are leading Sambandh Health, and there are many ex-bureaucrats who had been on our advisory boards. So this is all. This is the thing that we have worked in almost 15 states in the country, and with the government departments, police departments, with education departments, and we work with the youth on the both policy level and at the implementation level.
Working in Meghalaya?
Yes, currently our projects are going on in Uttar Pradesh, Andhra Pradesh, Karnataka, and Meghalaya.
Okay. So, how do you reach, or how do others reach to you? I mean, how is that networking?
Well, before the pandemic, we used to travel. We do a lot of programs with the youth, and we work on implementation. As I told you, like we work on the policy and implementation level both. So, and there's one Voice of Tobacco Victims, VOTB. That's the heart of our organization. It's a campaign wherein almost 400 doctors across the country volunteer their services for this campaign. So, like before the pandemic, we used to like visit places, but then this pandemic has really brought us back to our home. Now it's like it's like virtual mode. We work on the virtual mode. I would like to share my presentation. I'm here. I'm working as project manager of Sambandh Health Foundation, and I'm being joined with my colleague Ms. Aarti Gupta here. So as I told you that we started in 2011. We work in the mental health and the tobacco control fields, and tobacco and the youth. See, straight away I'm coming to this tobacco and youth because youth is at the heart of any program, and it's very important. We should involve youth in the all tobacco prevention strategies programs. Youth is at the heart of anything. Like if you really want to reduce the prevalence, you have to target the youth. Like if the research shows that the people who started consuming tobacco got addicted to it, 90% of them had started in their teens. So if the youths are targeted, in this they are counseled, they are trained, then this will really reduce the prevalence, the prevalence of the tobacco, tobacco in the country or anywhere else. Here, just I would like to bring in notice of our audience that there's a program called Tobacco Free Education Institutions Program, the TOFI program, and the guidelines of which were given by the Ministry of Health and Family Welfare. So under this program, like we are doing this program, and in these states currently, Andhra Pradesh, Karnataka, Uttar Pradesh, Meghalaya, and through this program, we till since last 1.5 year, we have been we sensitize around 6,43,000 teachers, and 1.4 crore students are being impacted.
To know how much of smoking or in a day, or how much of a bidi, a cigarette, or what kind of thing? How can you get the degree of addictiveness?
Well, see, if you see there, many tobacco companies, advertise their products by saying that this is light, this has got less nicotine, and this won't make consumers addicted, right? So there is nothing as such, light or low addiction product, right? So it's one tobacco is the main culprit here is the nicotine, which is really addictive substance. How we usually we normally see in the colleges, among our peer group, and you see like if when someone is smoking, like nearby person, someone says, "Acha, ek baar try karna," like ek baar try karna. So this ek baar try karna leads to a next time again one more try karna. So 1 to 2, 1 goes to 3, 3 goes to 4. So then the addiction starts. So there is nothing as such, that एक बार try करना, it's like, if you try only once, then you won't get addicted. There is nothing as such. The one who is smoking, the tobacco product is not only harming the smoker, it also harming, the people around that person
Yes.
through second-hand smoke,
Yeah.
right?
Yeah. The
So
environment inside.
yes, so there, as I said, there is nothing as such, like less smoke, less smoker, less tobacco product, that anything can leads to, any tobacco product may lead to very, very dreadful diseases. You saw the photographs there.
Yeah.
Those
Yeah.
were actual photographs. In fact, research says, yeah, in fact, the
We
research
see
says
these
that,
people. Yeah.
so if someone, let's say, if someone is smoking from couple of years, and now suddenly that person is stopped, but the impact of tobacco will remain even, for the next 10-15 years. Yes, our
If someone
intervention,
wants
yes.
to quit smoking, then they come to you. How do you
See,
do?
yes, our intervention basically circles around the prevention part. We work on the prevention side of, this program, and for, once the people who are addicted, who really want to quit, for them, government of India has a very, very fantastic service. It's a quick line service. The numbers are available on every tobacco products packet, so they can call that number, and there are many interventions which are being done, and they can avail these services.
What is the strategy that you are into in schools and colleges? You have started giving them education regarding the children that you are targeting at very early stage.
Well, see, like we are working with the various government, various, departments there, and our work circles around the youth. And there's a very, very good program by the Ministry of Health about the program called Tobacco Free Education Institutions Program, the TOFI program, wherein every education institute has to do, certain activities. There are 11 activities which every school have to perform in order to be called as the Tobacco Free Education Institute. So, and this, as I showed you those statistics, that almost 400, 4 lakh activities has been done till now under, through our interventions in the in the 4 states wherein we are working, right? So this program is really a game changer. Let me tell you, let me give you a very, one example. Like, in Meghalaya, we did an initial survey in the 5 districts, and we found out, like, there's one of the activity wherein the schools have to report the number of shops selling tobacco near, within 100 yards of their boundary. Okay, so we did a survey in the 5 districts, and there were really, really alarming results. Almost 43% reported that there are shops selling tobacco near their schools. And this easy availability of tobacco is the main reason why, children get into this menace, this habit. And we shared the data with the local administration, and they have started working on it, and we'll really see very good results in coming days. So this is one of our intervention, wherein we are really working to get these tobacco selling shops pack their bags and go away.
Okay, so are they effective? I mean, local authorities are working with you, so the
Absolutely, yes, absolutely. They are working. They were and they are working on ground on this thing. They formed a lot of committees are being formed for this, and they are in action now. So electronic cigarettes are actually, devices. They are electronic devices wherein they contain e-liquid, which sometimes have a nicotine and many other ingredients, carcinogenic ingredients, and those are heated. Once they are heated, they are battery operated devices, and those that liquid is heated, and once they are heated, they create aerosols which the smoker inhales, and now it brings the same impact what a conventional tobacco brings. And the tobacco industry is, they are promoting it as a, let's say, alternative to conventional tobacco, that by taking this e-cigarette, nobody will get addicted because it does not contain tobacco. But that's completely rubbish. This is a gateway to tobacco addiction.
Because the chemical that is present in tobacco is there, nicotine. Yeah.
Yes, and
So
many
it is
other ingredients are also there.
okay. Okay.
Yes,
So it has the same harmful effect, the same damage it does to your body.
absolutely, yes. And I would just tell a little bit about this law. This is very essential for our audience to know about it also. And there are the one of the sections, section 4 says there's a ban in public smoking.
Yes.
Okay, so public places like auditoriums, hospitals, railway stations, bus stands, all these places, nobody can smoke there. They would be fined around 200 rupees, and then and there spot fine.
Okay.
Again, selling of tobacco products near education institutes are banned.
Okay.
Yeah, and there should be a health warning on the tobacco product before it's on sale in the market.
No.
So these are some of the laws, and one of the best law is Juvenile Justice Act. The section 77 of the Juvenile Justice Act says that anybody found giving this tobacco product or any intoxicating product to the children below 18 years of age,
Yeah.
that person could be imprisoned or could be fined for 1 lakh rupees.
Wow.
That's a fantastic law in our country. The problem is still, if you see in the society in where we live, like people don't actually hate smokers.
Yeah.
If someone hardly we see still, I'm giving my own practical example. I see people, like it it is like it is still accepted in the society. Someone who is smoking, yeah, they don't tell, that stop it, please don't go
It's
somewhere
like a
else.
status symbol for some.
It is like a status symbol for some. Yes, yes, yes.
So, but then it turns out to be ugly when you start getting addicted to it. And once you start chain smoking, then it's very difficult for you to come out of it.
It's
But
almost impossible. Yes.
yeah, that's what I think. This is not illegal in our country. It's like having it and just a fag. No, they use this word a fag. So that is quite cool with the boys chilling
Yes,
out. With.
yes. Tobacco industry is very, very strong.
Very, very
This
strong.
tobacco lobby is very strong, and they don't. In fact, during COVID times, they proposed, that these tobacco products to be included in the essential items list. They actually brought out many things, many many. They gave a lot of information in support of this tobacco product, that it should be included in essential items list. In Andhra Pradesh, in one of the state, one of the district, I think it's Godavari district there, and wherein the district education officer, what she did, she brought out a really, really innovative activity. What she did, she told the students that you should these this I'm telling, this activity was given to the students during this lockdown when they are at home. Okay, so she told them that you go back to your house, while you are in the house, you write on the wall that this is a tobacco free house, we don't consume tobacco, this thing, right? Stand with your parents, take a selfie and share these photographs on the various groups.
Oh, wow.
See how, and this we took feedbacks on a lot of parents, and they said they are really moved with this activity. Children were telling their parents, their mommy, papa, please don't smoke, I feel bad, this will bring harm to your health.
Yes,
Well,
yes.
certainly they will listen to it.
Yeah, definitely. For their own children, parents can do these things. Yes, you are working with the best group that is coming out, the generation right now.
The mean age of starting tobacco in our country is 8 to 15 years. That's where we really want, this impact should go.
I've said that, I mean, of course, I believe that we can change things with the children coming into this, and every household having this kind of an awareness that the damages. So even the children know, even the parents try to come out with other ways. So that has been a good evening today with the information that you have shared with us, Manish, and all the best for your future endeavors out there.